The cervix is the lower third portion of the uterus, which forms the neck of the uterus and opens into the vagina. Cervical cancer is cancer that starts in the cervix. Cervical cancer was one of the most common causes of cancer death for American women. Then between 1955 and 1992, the cervical cancer death rate declined by 74%. The death rate from cervical cancer continues to decline by nearly 4% each year. The Pap test is the main reason for the decline. In the United States, cervical cancer occurs most often in Hispanic women, at a rate that is more than twice that of non-Hispanic white women. African American women develop this cancer about 50% more often than non-Hispanic white women. History of smoking: 1 or more sexual partners, having sex before the age of 16, having an impaired immune system, using birth control for more than 5 years. In most cases, there are no early symptoms of cervical cancer, which is why it is important to get a yearly Pap test. Symptoms of advanced cervical cancer can include loss of appetite, weight loss, fatigue, and pelvic pain. If you experience 1 or more of these symptoms for more than 3 days, you should check with your doctor. The Pap test is a screening for precancerous cells. It is not painful and mostly done in a doctor's office or clinic during a pelvic exam. A sample of cells is taken from the cervix and is checked for any changes under a microscope. Most often, abnormal cells are not cancerous. In case of abnormal Pap results, the cervix needs to be examined more closely. This is usually done by a colposcopy. This is a non-invasive exam performed with a light and magnifying lens. A biopsy is performed, where tissue is removed in a doctor's office with a local anesthesia. Then, a pathologist checks the tissue under a microscope for abnormal cells. When a woman is diagnosed with cervical cancer, her doctor will order more tests to determine how far the cancer has spread. This is called staging. Tests may include CT scan, cystoscopy, MRI, chest X-ray, and intravenous pileogram. As with all types of cancer, there are 3 main methods of treatment. Surgery can be performed to remove the cancer. This type of surgery is called a hysterectomy. It can be vaginal, abdominal, or laparoscopic. Radiation therapy is cancer treatment that uses high-energy X-ray or other types of radiation to kill cancer cells or keep them from growing. Chemotherapy is a cancer treatment that uses drugs to stop the growth of cancer cells by either killing the cells or stopping them from dividing. A new vaccine to prevent cervical cancer is now available. In June of 2006, the U.S. Food and Drug Administration approved the vaccine called Gardasil, which prevents infection against the 2 types of HPV responsible for the majority of cervical cancer cases. Practicing safe sex also reduces your risk of HPV and other sexually transmitted diseases. To further reduce the risk of cervical cancer, women should limit the number of sexual partners and avoid partners who participate in high-risk sexual activities. Getting regular Pap tests can help detect precancerous changes, which can be treated before they turn into cervical cancer. Pap tests work very well in spotting such changes, but they must be done regularly. Annual pelvic examinations, including a Pap test, should start when a woman becomes sexually active, or by the age of 20 in non-sexually active women. There are many support groups for women suffering from cervical cancer that offer education and prevention information.